PRP, or platelet-rich plasma therapy, is perhaps the most interesting and recent innovation in hair loss treatment. We've seen this technology and monitored it over the course of years in other fields of medicine, including orthopedics and cardiology, where it helps facilitate wound healing, cartilage rebuilding, etc. Practitioners in the realm of hair transplant surgery have also begun to embrace it, and we at Pacific Hair Institute have become believers that this therapy, which utilizes a patient's own blood serum, can in fact be helpful in combating hair loss. The technique is a simple one that we'll be demonstrating later, and employs simply collecting a small aliquot of blood via venipuncture into one of these specially designed tubes, then centrifuging the blood, concentrating the platelet elements, which contain an array of growth factors, which are then re-injected into the scalp in areas of hair loss, and over the course of months to years provide support to the hair in that area.
All right,
Having collected the venous sample of blood, it is now being transferred into this tube. It will then be placed into the centrifuge, which will perform the task of isolating the platelet elements, which we will demonstrate shortly. The last preparation step in the PRP involves the removal or separation or extraction of the now isolated PRP component of the plasma serum, which is withdrawn with the syringe from the centrifuge tube. So now we're going to begin the process of injecting the PRP into the scalp. So having been isolated, it is a simple matter of injecting small aliquots of the PRP into the treatment area on the scalp.
Okay, so Debbie here had a hair transplant about, I don't know, a year ago or so, to the front of her head. We also brought her hairline forward. We also filled in some scars from some surgery she had over on the sides and so forth. So anyway, 6 weeks ago we gave her her first PRP treatment in this front area. And today we're about to do the second one. So tell us what you've observed as far as your hair growth in the front.
Yeah, well, where they put the PRP in, it's been growing faster. And I had my haircut 2 weeks ago, and I already need my bangs trimmed again.
So the PRP we put in this frontal part here by the hairline, right?
Yes.
And so what you're saying is that these bang hairs are growing faster than the hairs on the rest of your head?
Correct.
Yeah, I think it looks that way.
Yeah,
it looks that way. So 6 weeks ago, here's a mirror. So 6 weeks ago, these bangs were what? Where were they cut at? Up here somewhere?
No, I actually had a haircut 2 weeks ago.
2 weeks ago?
2 weeks ago. And she cut it so that it was up.
Above your eyebrow?
Yeah, just a little above my eyebrow.
Okay, so that being the case, then it looks like these hairs have grown about 1 inch in 2 weeks.
They're going crazy.
That's pretty impressive.
Yeah.
Yeah. So do you want, now that we've completed the mission, do you want to say anything else to the camera?
It really was not all that painful. I mean, it hurt, but it's not unbearable.
And you could have elected to have anesthesia, but
Sure.
you said you didn't want it. So.
Correct.
Yeah.